usually 4 to 6 weeks, but it's also dose dependent. And so that's why it can take a little bit longer because let's say the low dose is too low for you, then maybe it's not as high of a dose as it could be. Any tips for staying up all night during a night shift? Yeah, I mean, you want to get your sleep schedule dialed in. If you have a night shift, then staying up at night has to be very normal for you. Like, if you're up all day, then up all night, that's very hard. I mean, obviously, caffeine and things, but you can also use meds like modafinil. So, one of my patients, she's a night shift nurse. And so, for her, we use modafinil at night to help um, with that. But that's the caveat is at the daytime, the sleep has to be dialed in there too. Any suggestions for getting off venlafaxine? Yeah, you got to go slow. You can't just rush it. Venlafaxine is not something that you can rush getting off of. So it just depends. The longer the patient's been on it, the slower you go. And usually the higher the dose the patient's been on it, the slower you go. So for example, I have this patient, we were cross-tapering from Effexor to Luvox to treat OCD. And so she was on 225 of Effexor. So we spent about 6 months just slowly weaning off of it. Like it was something that I was not trying to rush at all. Can a patient just stop all meds? Ideally not, because you don't know which meds are safe to stop and which meds are not. So, yeah, like I would definitely make sure to discuss it because some stuff you can definitely have a lot of withdrawal. Does Lyrica cause weight gain? It can, yeah, it can. Why Western medicine doesn't use peptides? I don't know. Probably because farmers brought into it. Like that's where that's the prevailing philosophy of Western medicine. But I'm sure that things are shifting, things are changing. Right? It's funny you mentioned peptide. I'm not really too much of an expert into that, but I want to learn more about it because, like, see, this is important. So if you're a provider, especially listening to this, you always need to be keeping up with your knowledge. Like, there's always new stuff coming up, so you have to stay up to date. And so right now, for example, people are talking about peptides, and I'm not an expert in peptides. Like, I don't know that much about it, so I need to spend time researching it and learning so that way I can be better at my job, a better psychiatrist. So simple. Simple, simple. I'm on Concerta 1 milligram. Oh, I already lost it. I'm on Concerta 18 milligram. Yeah, 18 milligrams is a low dose. The brain zaps after getting Effexor are wild. Yeah, so let me ask you actually, what exactly does a brain zap feel like? So for example, I've heard one of my patients say that it's almost like a camera shutter that's being clicked and that's what it feels like. Another patient said that it feels like a little electric shock is transmitting through her brain. So I'm just curious, how do you interpret electric shock or like brain zaps? Is 40 milligrams Jornay high or low? It's moderate. Moderate. Daughter in bipolar psychosis, they changed her to Caplyta. Yeah, Caplyta's got a little bit of a different mechanism, so that's why I anticipate. For me, it felt like my equilibrium was off. Yeah, okay, so let me ask the chat, right? If you've experienced Effexor withdrawal or you just come off of it and you've experienced a sensation known as brain zaps, what did that feel like specifically? Definitely the more specific you can be, the better. I'm very curious as to what your interpretation is. They have the same qualifications as a neurologist? No. No. I mean, it's the same like MD, but they did a neurology residency. I did a psychiatry residency. So, little bit different. For bipolar, do you think antidepressants shouldn't be used? They can be used. Sometimes if you have to treat bipolar depression, it can be used. Just have to make sure the mood is stabilized first. It feels like I have electricity running through me. Oh, interesting, interesting. Okay. Any other takers for the brain zaps? Brain zaps are like an electric shock in my brain and also a camera shutter that's 0.5 painless. Like an electric shock or a camera shutter, okay. Does it happen at certain times of the day or does it happen all throughout the day? It happened when startles felt like an electric shock from my brain to my extremities. Interesting. Electric zing. Many clients speak to that, respond. It's like a twitch. Yeah, I've kind of heard it's like a little shock or like a camera shutter. Those are the common things I've heard. Electricity flowing down, completely random. Oh, okay, okay. Well, I'm just asking, like, curious, like, out of curiosity, like, let's say does it occur right before the time of your last dose? How about that? So, like, for example, let's say you were on Effexor 225, right? And then we drop down to 187.5, and you take it once a day at 9 a.m. So, the blood level of the Effexor is in the highest withdrawal is going to be the greatest before you take that medication at 9 a.m. Because, right, like, if that's when it's going to be the lowest. And then it's going to get the best right after you take the medication or like soon after. So, what I'm wondering is that does the frequency of brain shocks increase, like, let's say in the hour or two before you have to take the med, or is it completely random throughout the whole day? Hours after a missed dose, yeah, missed dose, yes, exactly, yeah, because then, yeah, it's like right when the concentration's the lowest. Brains that felt for me a little sudden impulse that originated from the CNS and also spread to the PNS. Okay. I take lithium and lamotrigine for Lamictal, but the lithium gives me a terrible deep muscle pain in my legs. Is this normal? Yeah, I would definitely test your creatinine, just make sure that, and your creatine phosphatase, just to make sure there's no muscle um, wasting that's happening. Sometimes muscle wasting can happen, so you just want to make sure that that's not the case. Is there other non-controlled substance medications for ADHD, Intuna, and Strattera? Yeah, there's guanfacine and clonidine as well. Shout out, okay, shout out Patrick. Supplement out. No, no, no. It should be within the next week or two. Yeah, not out yet. A family member told me it feels like the back of your head and spine is also sitting. Yeah, and clonidine, yeah. Do you know the best meds to take for schizoaffective? Yeah, it's usually antipsychotics, plus maybe a mood stabilizer to help with the mood up and down. SSRI, SNRI doesn't work for me. What do I do? Check your diagnosis. You got to make sure the diagnosis is correct. I switched Adderall 7.5 2 a day to Dexedrine. Yeah, Dexedrine can be a little bit more concentrated than Adderall. That might be why. Sometimes switching from the IR to the ER might be better. My brother just got his call for deployment. Best of luck to your brother. 100 milligrams of Vyvanse. That's pretty high, honestly. It's pretty high. How to stop using benzos. Figure out how to deal with the anxiety without meds, and then slowly taper. Be appropriate. Help me lose weight at first. Should I increase my dose? Yeah, it just depends. If you're satisfied with the improvement, great. If not, consider increasing. Pretty simple. Thoughts on dihexa? I'm not sure what that is. So with the brain zaps, if I focus on it while it happened, I can feel it through the individual nerves, even especially fingertips and feet. Interesting. Yeah, because we do know that the SNRIs have nerve activity, and that's why they help with nerve pain, like especially duloxetine, but Effexor does as well. So I almost wonder if it like suppresses some of the nerve firing, and that's why it helps with nerve pain. And so when you withdraw from it, you kind of have the opposite. You have the activation. That'd be my hypothesis. What's a good Vyvanse alternative? Well, there really is no alternative. It's its own kind of thing. Concerta can be the methylphenidate equivalent, but it's not really an alternative. And then there's Mydayis, which also lasts a while. But if your insurance isn't covering Vyvanse, then it probably will not cover Mydayis. Why are ADHD, depression, anxiety commonly diagnosed together? It's because patients suffer with multiple things, and those are the top 3 most common diagnoses, right? That's like saying, why do heart attacks, obesity, and diabetes all occur together? Well, it's like they're all kind of the same picture. Is that pure metabolic syndrome? Is that pure encapsulations? Yeah, that's where I get most of my supplements from. Why isn't insurance covering 5% lidocaine patches? I don't know. You'll have to ask them. Just because remember that insurance companies, like, their model is to get you to pay for services without them paying you anything, right? Like, that's literally how they make money. Do you think I should up my Concerta dosage or switch to Adderall? I mean, it's hard to say, right? You gotta know your full history. Favorite type of fruit? Probably blueberries, apples and blueberries. Blueberries if I'm trying to put them onto my Greek yogurt, or blackberries actually if I'm trying to put them onto Greek yogurt. But apples if I'm just like wanting a fruit snack. Thoughts on vilazodone? I like it. I've been getting warmed up to some of the newer antidepressants. I'm finding that they've had, anecdotally, they've had less side effects in my patients. So I'll often use them if I have patients who've had side effects to specific things. Does Azusa Pacific University have a solid Psych NP program? I'm not sure. I'm not sure. Because I went to med school, so I don't know. I feel like bipolar with ADHD is hard to treat. It can be, but you just have to make sure the mood stabilizes first. I have a video on bipolar versus ADHD, so you can definitely check that out. It's right on my YouTube. Thoughts on MD versus DO, whatever you can get into. Obviously, DO is going to be easier to get into than MDs. And it's only pre-meds who care about that stigma. Once you're in med school, especially once you're in residency, and after that, like, literally no one cares. Like, it's not, people don't even think twice. It doesn't really impact job opportunities that much. So, yeah. Bupropion for chronic fatigue. Yeah, it could be helpful. But figure out why there's a chronic fatigue, right? Like, that's the thing. Is it from, like, just a lot of anxiety? Is it poor diet? Is it lack of sleep? Is it some chronic condition? Is it depression? Whatever it is. Whatever it is. Cyanamazine work for psychotic episodes? I've never heard of that medication. Does the school you graduate from matter? Nah, not really. Doesn't matter. Unless you're trying to, only if you're getting some super academic job, that's when it matters. But outside of that, literally like normal jobs, like normal just patient jobs, like nobody cares. Literally no one cares where you went to med school. So, it's only like pre-meds and med students who care about that stuff for like chasing prestige and things. But pretty quickly people realize that it doesn't matter. They're all just brand names at the end of the day, The same disease is the same disease process. Like, depression is depression whether you you learn it at one school or a different school. Can an NP practice solo in California? I don't know. I don't know what the rules are. I had really poor motivation and energy from bipolar depression and modafinil. Yeah, I bet modafinil can work really well. Nice, but we're at 7.5K lecture now. Let's see if we can get to 10K. 10K should be very, very reasonable and doable for us. Especially if we're at 7.5, 10K is like right around the corner. And we got 107 people in here, so we're cooking. We are literally, we're cooking. This is a Saturday afternoon or Saturday evening, I guess, at least for me. So I'm sure that you're probably getting ready either to go out or you're doing your evening plans, whatever it is. Yeah, what are your evening plans, by the way? What you got going on? You going out? You staying in? You getting dinner? You watching a movie? Doing board game night? Playing a video game? Spending time with your kids? Going on a date? Yeah. What are you doing tonight? 11 p.m. for me. Okay. So you've already kind of had your Saturday night fasting. Yes, Ramadan is upon us. So yeah. How was Resident Evil? Good, nice. Yeah, I've played the first couple hours, and so I'll probably play more after this. I wait till it gets dark to play, because like the way my setup is right now, like there's a whole bunch of light that comes in, and so playing a Resident Evil game is not the same, obviously in the dark than at night. Bed rotting due to depression. Well. You can't keep focusing on that, right? Focus on the things you can do and focus on taking the right actions. I have a date with the physician. Oh God, you're cooked. You are cooked. Just don't talk about medicine with them. Just here watching the U.S. bomb. Yeah. See, don't keep up with world politics and news. Like if I could give One of the most underrated piece of advice is just don't watch the news. Because think about it, are you going to be able to change it? No. Is it going to make you feel better or worse? Worse. So does it help your life in any way? No. Does it worsen your life? Yes. So what do you accomplish? Nothing. Like, remember that the news networks, they sell fear, like they exist to sell fear. And they prey on our survival mechanisms of prioritizing negative information more than positive information. So they prey on that. So that's why the news outlets only put out negative stuff, right? Like, if you think of, and the reason that they push that stuff is because they know that people are going to listen, and it's all a cycle. And as a content creator, I understand it more better than most people, because let's say they put out negative stuff and now people are like really into it. Well, that incentivizes them to keep on putting out negative stuff. Then it also incentivizes the people in power to also do more negative stuff, because that's how they get published. That's how they get more attention and more notoriety and more fame, and more attention on whatever they're doing, how their brand grows. So like the whole world is incentivized to do that. So once you understand that, you're like, okay, well, why am I feeding into this? It's a Netflix and DoorDash evening. Nice, nice. My therapist told me to stay away from media. Yeah, I do that. Yeah, I don't care. You can call me ignorant or stupid or whatever. Like, I stay away from media. Like my sister's really into this Epstein conspiracy stuff, and she's like, oh, the letter showed this, the letter showed that. I'm like, and she's always like texting a group chat this kind of stuff. Like, I'm like, who cares? Are you gonna be able to do anything about it? Are you doing anything? No, you're just getting enraged about this stuff, posting in the group chat, and then going to your job and then, like, doing your normal day-to-day hobbies and activities anyway. So it's like, why are you burdening yourself mentally with that? But that's the psych in me, right? Remember that the way I think about it is that your diet, or the just like you can have a physical diet, you can also have an information and media diet. And the information you feed yourself is the diet of your mind. The information you feed yourself is the diet of your mind. So why would you feed yourself? Just like you wouldn't feed yourself poison. Why would you feed yourself poison info? And honestly, like, I honestly think if nobody paid attention to any of this stuff, like, it would get better. A lot of, not everything, obviously, because I think it's important to, of course, draw attention to issues. Like, that's how they get addressed. But there are some things that, they keep on perpetuating because people keep watching them, like celebrity drama. Like, the only reason that the celebrity dramas even exist, like, drama exists, is because they know that people watch it and it makes them stay relevant, especially because now celebrities have a lot of competition with influencers, which they didn't have 10, 20 years ago. Like like, have you noticed how in, like, the Academy Awards, the Oscars, there's always some controversy, like Will Smith slapping the other dude, or the mess up that happened with Moonlight and La La Land. Like, isn't it funny how there's always something that happens? Well, I think it gets some attention. So I think that most of this stuff is manufactured and fake, because it's literally just keeps them all attention. It gives them more attention. People talk about it. But that's my opinion, at least. Controversy sells. Exactly, exactly. Yeah. I mean, it's the same thing in content creation, right? Like, if you're more of a controversial content creator, whether people love you or hate you, you're going to grow way faster than if you're just like a normal creator, and like, just talking normal stuff. If you make your message more extreme, then you're going to stand out way, way more. And so you're incentivized actually to be more extreme. Simple. So once you understand that, you're like, okay, that's how you stop yourself from getting taken advantage of by, like, these old content systems. So really, really important to recognize that. Also, nice, we're about to reach 10K. I see we're at 9.9 right now. This is the countdown to 10K. Who will be 10th K? Will it be Bryce444? Will it be... It might be Bryce. I think it was Bryce. I keep seeing... Yep, Bryce liked it. Daedra. Yeah, Poppy, Sam. Wow, we are rolling here. We are rolling. Nice. How would you treat someone who's suffering from long-term social isolations and chronic loneliness? I mean, you got to get out there, right? So you got to start small and you build up. It's not like you can just go from being lonely to having a thriving social life in a day. You know, you build up slowly. You build one friend, then two, then three, etc., etc. You go out to one event, then two events, and three events. Right? It all is a spectrum that you slowly start cultivating over time. Hi from Florida. Nice. Hi from Florida. I'm planning to move to Miami in next 6 months or so. So I will see you there in Florida. Do you have tips for fourth year psych audition rotations? Yes. Think of yourself as an intern now. You're not auditioning. You should know everything going on with the patient. You should know how to make. You should know how to do the history. You should know how to develop a differential diagnosis, and you should be able to take a crack at whatever treatment you want the patient to undergo. Can stress be a huge factor with IBS? Yeah, of course. The gut and the brain are very interlinked. So stress causes gut issues cause stress issues. You fix the gut by, fixing a lot of the stress, and you fix the stress by fixing a lot of the gut. So it's all interconnected, all interconnected. Thoughts on GLP-1s? Yeah, it's a tool. It's a tool that can be used. I'm not against it. I just think that if you use it, you should also be learning how to do the proper diet and exercise and all that stuff. Because if you don't, then either you stay on the GLP-1 for life, or the weight comes back as soon as you quit the GLP-1 because you never actually learned how to eat. What are your thoughts on Caplyta? Yeah, it's a one of the newer antipsychotic. I like it. It's very simple to dose. So from a practitioner point of view, I like that. Um, Weight gain tends to be more minimal, so I think that's nice as well too. But it's one of the new ones, so it's expensive, right? It's not the ideal. Have you heard about poor intestinal health being related to depression? Yeah, poor intestinal health is related to everything. It's related to everything. It's related to poor skin care. It's related to depression, anxiety, all of the above. All of the above. How old were you when you graduated? It depends. Graduated what? College, med school, residency, fellowship. Done a lot of graduations throughout life. High school, middle school. Do you implement therapy in your psychiatry sessions? Yes, yes. Yeah, because I do more of a concierge private practice, so I want to make sure the patient gets a lot in each visit instead of just like a 15-minute, here's your med, peace out. Peace out and have a good day. Are there any contraindications with GLP-1 and Wellbutrin? No, no, not really. All the schooling for medical, yeah. So I graduated med school, or sorry, undergrad when I was 22. I graduated med school when I was 26. I graduated psychiatry residency when I was 30. And then I graduated fellowship when I was 31. Yes, and I'm about to turn 33 this year. How long is the wait list for appointment? It depends. If you're going to like a just standard pill mill insurance psychiatrist, probably months. If you go to somewhere that's more concierge, that's more in depth, but it's outside of insurance, then probably a week or two. Like for me, right, I keep my patient panel small so I can invest more time and energy into each patient rather than just kind of like churning out patients. Like a lot of these places, like they literally do that. They'll just like crank out patients. You just crank out patient after patient after patient. A lot of the psych NPs, for example, in my program, tell me that the place that they work at, like they're just told, okay, see patient, see patient, see patient, see patient, and because that's what makes the clinic money, right? But it doesn't really conclude to good patient care or much learning from the provider, because you have to be able to sit with cases and think about them for a while. TikTok nurse practitioner says, love the book, love the look, thank you, appreciate that. If you didn't do psych, I'd probably do radiology, right? Just because I like my dark room, I like being away from the hospital, I like my own privacy. So I probably do rads. You seem very balanced. I can be, but I can be extreme too if if the situation calls for it. So it just depends. But yeah, yeah. I just try to make sure my three buckets are filled. What is it? It's love, health, happiness. No, it's health, wealth, and relationships. Yeah, health, wealth, and relationships. Right. So health wise, making sure I'm eating clean, going to the gym, or going to boxing. So that's like sleeping well. Like all those things are top tier priorities for me. Wealth wise, right? Like working on my business, working on my social media stuff, working on my practice, working on my NP coaching, all of that, right? Just making all of those things the best they can be, and then relationships, right? Family, friends, love life, all of that. So once you unlock those three buckets and you focus on them, you know, everything else is not that important anymore. Ultimately, that's the stuff that leads to happiness. Carlos says, been experiencing a lot of brain zaps. Yeah, usually that can happen if you're tapering. So sometimes you have to go taper slowly. But it is normal to experience that. What's your take on DGT mental state? See, I don't keep up. I literally don't keep up with politics or anything. You are so right. Yeah, yeah, yeah. I mean, that's literally that's the secret formula to it. That's you want to know the meaning of life? Love, wealth, or health, health, wealth, relationships. That's the meaning of life. Fulfill those buckets and keep leveling up. That's it. That's the meaning. There, boom. I just solved it for you in one sentence. And like it's always been like that since the test of time. Like back, let's say back in the day, right? Like millennia ago and like hunter gatherer days. Okay, they may not have had cash money, but wealth meaning resources, right? They had food, they had water, they had shelter. They had the resources to be able to live life, have happiness, like that type of thing. Live comfortably, basically. So yeah. EMDR therapy and somatic therapy, yeah, it works. It's good for trauma, right? Trauma can't be healed by just medication alone. A lot of it's learning how to calm down the nervous system. Excuse me. So, like, that's a big part of it, right? Because ultimately, with the trauma, it's like, okay, what's done is done, but now the person has to figure out how to live with it, how to function despite all the hyper arousal and all that stuff. So, and that's their responsibility. They have to learn how to do that. Like, no one's going to come to save them. I have a saying that, okay, trauma is not your fault, but it is your responsibility. Meaning that if something bad's happened to you, you can't sit there and play the victim and be like, oh, woe is me, I'm crying, and this happened and that happened, and wow, the world's so unfair and this person's unfair. Like, yes, that's true. But that mentality is not going to help you get better. Like, only by taking responsibility, okay, what's done is done. Now let me do what I can, is ultimately what's going to help you. Right? It's like if my roof caves right now and it falls, I could blame the weather, I could blame the snow, I could blame old house. But at the end of the day, that's not going to make a difference because right now my roof is caved in and I need to figure out what to do ASAP. So, same concept. Liothyronine causes anxiety. Yeah, maybe the dose is too high. I always like to optimize doses before adding in something to counteract like a side effect, for example. All right, all right. Let's get our refill of the sparkling water. So we got our OG. This is the Pellegrino. Butts and bolts is changing my life. Right. If it's working for you, that's awesome. I wouldn't tell you to change it at all. Right. So there's multiple things that can work for people. It's like imagine if you're trying to lose weight. For some people, like tracking their diet works really well. For other people, it's just getting more exercise. For other people, it might be cutting out friends who just want to go out and eat and drink all the time. For other people, it might be just eating the same thing every day. Like you figure there's different solutions for different problems, or there's many solutions for the same problem a lot of the time. So you got to figure out what solution works for you. Nice. So we got our sparkling water refill, and yeah, we're hydrating. We're hydrating. Electric sock. What do you mean electric sock? Electric shock, I mean? It's called electroconvulsive therapy. I wouldn't really call it electroshock. That's very degrading to the progress that it can give someone. People saying the same results with compounded Auvelity compared to actual. Yeah, so sometimes I'll do a DIY where I'll mix dextromethorphan and bupropion. It's hard to say whether it'll get the same results because there's been no clinical studies to assess that, right? Who's going to pay for a clinical study to assess the DIY version? The pharma companies certainly won't. But anecdotally, yeah, I think you can get similar responses. Do you follow Zerka? No, I do not follow Zerka. I think he's very out there, very extreme. And again, just for the purposes of being extreme, right? A lot of these content creators, they're extreme just because like you get some views and stuff. And like that's how you stand out, right? It's an arms race. So if person A does this, then person B has to go up a little bit higher to stand out. Then person A has to go a little bit higher. So it just becomes an arms race. You should try Vimto. What is Vimto? I don't know what that is. Does it help with bipolars? What does what help with bipolars? Is 5 milligram risperidone a high dose? Yeah, it's actually pretty. It's up there. It's not as high as like 8 milligrams. That's usually the max, but 5's pretty up there. I had genetic testing done. I have a specific mutation that doesn't allow me to take SSRIs. See, that's incorrect. There's no mutation that doesn't allow you to take SSRIs. It's just that you might metabolize it faster or slower than normal, or the receptor might be a little bit more downregulated. That's all. It doesn't mean that you can't take it. That's all. So that's the most important thing. The genetic testing, I think, has been such a fuckery of psychiatry. So yeah. Lex says I always join you when you're on my FIP, but I followed you. Nice. Well, welcome to the tribe, the squad, the clan, the live streams here. Is EMDR okay to have when a person is bipolar? Yeah, that's fine. That's totally fine. It's actually a very natural way too, right? Because the EMDR is all about like mental processing work. What types of therapy do you employ, like DBT? Yeah, I like exposure a lot, CBT, supportive. Those are usually the top two. I'm not a therapist, so if I'm trying to do full-on therapy, that's what I'd rather refer. It makes more sense for someone who's dedicated to that to do that. Simple. But yeah, we might actually, my phone battery's getting low, so might be the time to call it, because I've been wanting to play as this Resident Evil, so I've played a little bit of it today, but I definitely want to hop on and play some more. So it's been itching, and the way I kind of think about it is like I just want to get all my work tasks done. It's like, okay, work task that. So gym, check. I did some my patient care work, like filling messages and stuff. So that's check. And what else, right? The live stream, check, like this, like the daily stuff, check. So I'm just checking off all of those things. And let me see, what else do I have to do? I was gonna be not recording, but like scripting some YouTube videos. But I might do that tomorrow, actually. I think I might wake up tomorrow and then do it, because I don't have a workout plan tomorrow. So I might just wake up, drink some coffee, and then work on the scripts. So yeah, that's the main game plan for tonight. Is playing RE. He's avoiding burnout. Exactly. I gotta keep the brain sharp. Gotta stay humble. Can't get arrogant up in here. Yeah, and plus my brain can only work so much. Yeah, you think about this. Okay, let me ask you this. How many other doctors are out here spitting game on social media on these lives, right? Like no one else is fucking doing that. Every other doctor you see out here is either A, at the hospital, or B, they are living their life like, oh yeah, I got my weekend. But no, we are here, we are working, we are vibing together, we are dropping game, we're spitting knowledge here. So, that's what you get when you are on this channel, right? You get that drop to you every single day on these lives here. So, yeah, I'm glad that you are tuning in, and you get it real as well too. A lot of these doctors, let me tell you, they'll put on these fake personalities, and they will act also professional and stuff. Well, let me tell you straight, because I hang out with these people outside of their clinical stuff, and they are just as degenerate, as faulted, just like all of us, and I'm no exception either, right? Like we all have our own problems, and we're all human beings at the end of the day. So don't get it twisted. This is where you can get the the real stuff. But yeah, I'm glad that you were tuning in. This is yeah, what is it? Saturday, 5:45 p.m. Eastern Standard Time. At least for us. So yeah, just remember, right? So if you're an NP, you can definitely check out our coaching program, right? See if it's a good fit for you, especially if you're newer. If you're a patient, you want to work with me, best way to do that is just book a consult in our bio. We can see if we're a good fit to work together. But otherwise, yeah, I hope you have a good rest of your Saturday night, and I'll see you tomorrow.